My husband, I think he was diagnosed around 86 or 87, and he didn't tell me. I felt that pain and that anger, like, how can my husband do this to me? And he never wanted to use condoms, and I used to tell him, let's use condoms, put on a condom. I would make sure, and he would put it on, and then when we were busy, he would remove it, and I wasn't aware of it. And I don't need a condom, I'm good, I don't have anything. So I took his word for it, as many of us women do. Especially the Hispanic community, we just take our husband's word for it because we don't want to doubt them, we don't want to make them feel less than, because we're supposed to make them feel like macho man. Yeah, well, my mistake. So, you know, it was all about I love you, I love you, I love you. He used to beat me, but I used to see my father beat my mother, so I thought that was normal. That's another thing in the Hispanic community. I allowed all my lovers to hit me, men and women, because I thought that was love. Until after I was diagnosed with AIDS. I said, I will be damned if I let anyone mistreat me, yeah. June 2nd of 1992, that's when I was diagnosed with an AIDS diagnosis, because I had 0 T cells, and my viral load was in the millions. I froze because the nurse was very rude. You know, they look at you, they see you're Hispanic, and they assume a million and one things. They assume you're on drugs, they assume you're a prostitute, they assume you're reckless. She just came in with my chart, threw it on the table, said, you're positive, and walked out and left me there. I mean, there was nowhere to go. There was nowhere for women. First of all, HIV positive women were not even recognized during that period, because it was called GRID, gay-related infectious disease. So they assumed it was mainly just for gay men. So women were not being tested, and they did not guide us well. No one is there to talk to you, guide you through while you're going through the diagnosis. No one is guiding you through treatment, advising you on the importance of treatment so you can get to viral suppression and get to undetectable. So that's when I said, oh my God, I need help. After I found out I was HIV positive, I said, oh my God, I'm gonna die, because I buried my 2 brothers and my sister to AIDS-related complications. So that was the first thought, I'm gonna die. My mother told me, come and stay with me. I will help you, I will feed you, bring good nutritious food. I will give you the strength you need. I had the pneumonia, I had the TB. I was real skinny, I couldn't walk. I was so depressed, I did not want to go outside because people would look at me and say, oh, look, she has the monster. You know, I was so skinny, you could tell. So they would say, oh, she has the monster, she has the monster. They did that with my brother also. He fell in the street and they didn't want to touch him. They said, don't touch him, because he has the monster. I'm sorry. And it was horrible. They treated you like if you had leprosy, you know? So I was so depressed, I would just put the shades down, stay in the bedroom, watch TV. And it was very difficult. But I said, you know what, Lily? You must live. You must live for your son. I refuse to die. So I said, Lily, you must take the horse by the rein and start galloping. You know, you see the British are coming, well, this Puerto Rican is coming, okay? Yo no voy a dejar que esto me acabe. I said, this is not going to end my life. I went to my infectious disease clinic, which was the first clinic that was opened in Manhattan, and my nurse handed me a flyer. It was from GMHC, Gay Men's Health Crises. That was the first organization that opened up 40 years ago. GMHC was the only one I was able to attend. and meet other Latin people and black and white, and we all blended in. It was a community. I embraced it. They embraced me. We would say, oh my God, eat this, eat that. Everyone would give each other advice. And not long after, I said, I want to work here, because GMAC gave me my life back. When U equals U was first announced in 2006 to my white privileged friend, Bruce Richmond, which is the director who started U equals U, the doctor told him, we do not want the Hispanic community or people who live in the poverty communities to know about this. Because they say we'll go crazy and we'll have sex with condomless, condomless sex, without protection, and we'll just be spreading STIs. But why would they assume that the Hispanics are gonna go crazy and not use protection and spread STIs among each other? Because it's mostly Hispanics who are affected by this. Mostly Hispanics who were not educated on HIV and AIDS, who were not educated on treatment, who were not educated on prevention. No one told them use a condom to prevent STIs, They just get gonorrhea and syphilis and it's okay, we'll treat it. No, it's not okay. There are preventative measures, and this is what I wanted to get across to my Hispanic community. 30 years ago, it was very difficult to find Spanish-speaking staff members, doctors, nurses, receptionists. So back in the day, it was very difficult for the Latin community to seek help. They would give up, and they fell out of care. They did. Today, it still exists, not as much as it did 31 years ago, but it still exists. I don't see Spanish literature. When I go to a clinic, everything is in English. They have clinical trials, that's in English. If you don't speak English, a lot of them say, look, she doesn't speak English, I can communicate with her, have her go somewhere else. You need to have Spanish-speaking staff and help walk them. Some of them come from countries where they don't have these opportunities. They don't know how to speak up, they're very shy. And I notice if you say anything, they'll kind of go into a shell and retreat. I've dedicated my life, yes, to working in this field. Some people tell me, Lily, please stop talking about HIV. No one cared about HIV. The Hispanic community did not want to talk about HIV. Everything had to be swept under the rug. You didn't talk about it. You didn't talk about it to your family. My mother didn't want my family to know. So when I was interviewed at Channel 47, I told my mom, she goes, oh no, you can't, because everyone in this building watches Channel 47. I said, well, I'm sorry, Ma, I'm not doing it anymore. I can't allow you to stigmatize me like this. This internal stigma is killing me, is eating me inside. I can't, and I must speak up so that my Hispanic people can also speak up. This is why I disclose my status, because it affects me, it affects my community, it affects men, women, children. It's important that I get the message out. It's important that I let people know, even though you are newly diagnosed, you will live, you will live. And I let them know that I've been living with an AIDS diagnosis for 31 years. And everyone says, oh, shouldn't you be dead? I said, should I? But I said, I'm not giving up, I'm not giving up. If you're determined, you can make it.